This is Dr. McNeil from Crown Point Optometry, and today I'm going to be talking about the top 10 health conditions that have an impact on your eyes. So, counting down from number 10, we're going to be talking about sarcoidosis. Sarcoidosis is a condition that does have a genetic component, and it impacts a lot of organs in the body, most predominantly the lungs, but also impacts the inflammation can happen in the eyes, which can cause both discomfort as well as vision problems and red eyes. Number 9 is Lyme disease. So Lyme disease impacts also many systems in the body, but it can also cause infections and inflammations in the eye itself. So that's another one that needs to be checked. If you have Lyme disease, you definitely need to get a proper eye exam to make sure that isn't happening.
Number 8 is shingles. Shingles causes eye infections that both cause pain and redness as well as some blurred vision. And just like shingles tends to reoccur in episodes in the rest of the body, it does the same thing with the eyes. The good news is there are both preventative options as well as antivirals that can treat this sort of infection.
Number 7 is sickle cell disease. So sickle cell disease is also has a genetic cause, and it means that the blood cells are not the normal shape. There are blood cells that have an abnormal shape that tends to get stuck in the blood vessels, including in the blood vessels of the eye. So these people often have problems with blood vessels blocking and things like that, and causing retinal detachments, etc., in the back of the eye, sometimes starting at quite a young age. Number 6 is HIV. So going along the um, infections route, HIV is likely to make you more prone to opportunistic infections everywhere in the body, of course, including the eye, if the disease is not well controlled. But also HIV itself can have some impact on the circulation of the blood vessels in the eye, causing some problems there. So it's definitely important, regardless of how well controlled the HIV is, to get an eye exam if you're in that situation. Number 5 is Sjogren's syndrome. Sjogren's syndrome is autoimmune in nature, and it does impact a lot of parts of the body, including causing dry mouth and dry eye, as well as some joint issues. So it is also important to know, is my dry eye due to Sjogren's or due to something else, because Sjogren's patients are at a higher risk of certain cancers. The next one is myasthenia gravis. So myasthenia gravis impacts the ability of the muscles and nerves to kind of communicate and function properly. So there's often kind of weakness, drooping, things like that of the muscles, including the muscles of the eyes and the eyelids. And sometimes it can show up in the eyes sooner or exclusively before the rest of the body is impacted. Number 3 is multiple sclerosis. Multiple sclerosis is a demyelinating condition. It may be autoimmune in nature in most cases. So where the myelin, the insulation around the nerves, is impacted, including in some cases the optic nerve, which means the optic nerve can sometimes get inflamed and have trouble transmitting the information properly, as well as the nerves that innervate the eye muscles, so some eye muscle problems like abnormal eye movements or abnormal eye alignment can result in the case of multiple sclerosis. Number 2 is high blood pressure. So high blood pressure impacts the blood vessels all over the body, including in the eye. But the good thing about having an eye exam is that we can see the blood vessels directly without doing surgery. So oftentimes early signs of damage from high blood pressure can show up there, in terms of things like causing small bleeds or swelling at the back of the eye. And the number 1, probably to nobody's surprise, is diabetes. So diabetes, because of the high blood sugars and other associated complications, the blood vessels are not as strong as they should be, which makes it more susceptible to bleeding, and as well as things like retinal detachments can happen in diabetes, as well as sometimes impacting the nerves innervating the eyes, so there can also be eye movement problems sometimes in that case. So if you do have diabetes, you've probably already been told the importance of getting your eyes tested, but this is just for the people who may not already know that information. So all this is to say that eye health is an important part of your general health, and a lot of general health conditions can impact your eye health. So that's why it's important to look after your whole health, including your eyes, especially if you happen to have a condition that can impact your eye health. Thank you very much for listening. You can go ahead and subscribe, check out the website, and have a nice day.